Good afternoon. I'd like to welcome and introduce Dr. Robert Murphy, Executive Director of the Robert J. Havey, MD, Institute for Global Health, and the John Philip Bair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine, who answers your COVID questions every Tuesday and Thursday here on the Havey Institute for Global Health's Facebook page. And today, Dr. Murphy will be answering viewer-submitted questions and addressing the latest COVID headlines through today, the 25th of January. And we invite you to continue to submit your questions to us via Facebook at NU Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. And leading the discussion again today is Sophie Wiskowski, who is a student research assistant with the Institute. So Sophie, I now turn it over to you.
Hi, Dr. Murphy.
Good morning.
Now for some updated COVID statistics. In the United States, yesterday there were approximately 1 million new cases that were found due to COVID. Booster shots are at 25%. Hospitalizations have increased by 13%, and deaths have also increased by 25% in the United States. Fortunately, in Illinois, we are seeing a slight decrease in death rate, still a slight increase in hospitalizations, but the overall cases in Illinois are slowly starting to decrease. We are also seeing about a 24,000 positive new cases every day in Illinois, which is about a 10% decrease over the last 14 days. What can you tell us about what's going on in the United States that sometimes we're seeing 1 million cases and sometimes we're seeing 300,000 cases?
Yeah, well, it's the United States is geographically very large, and what we're having sort of two epidemics at the same time. So the Northeast and the Upper Midwest got hit very hard earlier, and so we're seeing our peak now and seeing the beginnings of the decrease. However, other parts of the country excuse me, are still increasing. So overall, you're seeing a blunting of the numbers and a smaller increase every day. But it's all going in sort of the right direction. And you should see a very sharp decrease in the next couple of weeks. So many of the modelers have predicted that you'll really see this in the second or third week of February.
That's wonderful news then. Hopefully it's coming around the corner.
So it's a little bit of a month off. So originally they thought that this was going to happen in January, but it's just, the United States is just too big. And it just kept spreading because the country is so large. So I think taking that into consideration that they're off by 1 month, that's okay. But it is going to be going down, and it should go. Then the big question really is, how much immunity are all these million people a day getting from Omicron?
Right.
So we haven't seen Omicron reinfections yet. Typically that takes about 3 months with the other variants. With Delta, Delta didn't give hardly any protection for Omicron. So people got Delta in December and got Omicron in January. But it'll be interesting to see how good the immunity to Omicron really is.
Right. No, absolutely. One of our big COVID headlines for today is that the FDA is halting use of the antibody drugs and they don't work against Omicron. What can you tell us about this halting of the use of the monoclonal antibodies?
Yeah, this is very unfortunate. The Regeneron and Eli Lilly monoclonal antibodies, which had worked really well and prevented hospitalization in the people that received them, don't work for Omicron. The GSK antibody and the AstraZeneca antibody work very well, but they're in short supply. So just getting those Regeneron and Eli Lilly off the market is a good idea because they're not cheap and they're not doing any good.
Right, absolutely. Our second big headline is that the Biden administration is now going to distribute, starting sometime next week, 400 million N95 masks for free to the public. What can you tell us about how this is going to benefit the United States?
I think the message here is, these masks are not that expensive. People probably can't afford to buy them. They work much better than the regular surgical masks or any of the cloth masks. But I think the message here is that you want to upgrade your mask. Omicron is so much more contagious, and most likely anything that supersedes Omicron is also going to be really contagious. So you've got to upgrade the mask. So remember, A cloth mask, there's a lot of variability in the efficacy of cloth masks, from almost 0 to maybe up to 20% or so. So you have 20% there. For the surgical masks, it's about 40%. If you put the two of them together, or two surgical masks, it's like 80–85%. And then you get up into the N95 and KN95 and KF94 masks, and the FFP2 in Europe, and those are like 95%. So you want to get up on that mask chain, and particularly to avoid just the cloth masks.
Right, definitely.
Mhm.
And, speaking of the pandemic in and of itself growing, as you mentioned before, Fauci suggests that the Omicron wave is peaking, but warns more pain to come.
Yeah, it's basically what I just had said. The country is just so big. So
Right.
you have areas that it's increasing and areas where it's starting to go down. And those areas that are increasing right now, they're going to hit their peak probably in the next couple of weeks, and then they'll start going down. The rest of the country already is going down, and you'll see that a steeper drop off at the end of February.
Wonderful. And our last big COVID headline for today is that the White House is now producing free take-home COVID tests. How do we order these COVID tests, Dr. Murphy? And what are they doing about the cold? Do you know?
Yeah, well, you're supposed to store these COVID tests in it can be down to refrigerator temperature, but it's not supposed to be frozen.
Right.
I'm not sure exactly what happens. I've been asking around. I haven't gotten a good answer yet. I'm going to have to really look into this a little more carefully with some of the manufacturers. But it also they have a control strip, a control line on the test. And obviously, if the control line doesn't light up, there's something wrong with the kit. But I really can't answer the question about what happens if the test is frozen in the mail, because it's sitting in your mailbox, for the day, and it's so cold outside. So I'm going to have to do a little more homework on that. Probably for a short period of time, it's probably, I would just imagine that it's probably going to be okay. But there's a better answer than probably okay. So I'm going to have to do some homework.
Wonderful. Well, now we're going to move on to our COVID questions. Dr. Murphy, can you explain the COVID variants and how they develop? It seems like the latest variant Omicron is more contagious, but not as lethal as the previous variants. Are new variants just watered down strains of the previous variant?
Well, what it is there's so much virus, trillions and trillions and trillions of viral particles, and they make mistakes when they replicate. And so typically the wild type or the dominant type is going to overtake any of those mutants, so to speak. However, when you throw in any kind of treatment into the mix, a monoclonal antibody, antibodies from the vaccine, what happens is some of those mutants are likely to be those interventions don't work. The antibodies from the vaccine say that's one of the most concern, and we've certainly seen that the risk of infection with these variants, they're not that effective in preventing infection. However, there's more to the immune system than just measuring antibody levels, and other parts of the immune system do kick in and prevent severe disease. It starts as a upper respiratory cold type thing, and then in those people, some people, it goes down into the lungs, causes pneumonia, which can kill you.
Right.
So the immunity that you have been getting from these vaccines and some of these other therapies prevents that. So the vaccines have become preventative mostly for severe disease. The hospital is full of people who are unvaccinated.
Right.
So there's plenty of infection out there, even in vaccinated people. So you're still getting the protection. But anyway, this is the whole thing with variants. So variants are as long as there's tons of this stuff replicating, you're going to find variants, especially as you put in different mitigations, vaccines, treatments, whatever. You will find some of these variants will take over. So it's just a matter of time before another variant comes. Delta came, last fall. when we were thinking, oh, you know, it's the end of the summer, but this is not when we really see variants come, and all of a sudden Delta just took over. And then before that was even done, Omicron came.
Right.
And Omicron just swept the world in a matter of, you know, from November 11th until now. Look at the damage, what that thing has done. Highly, highly contagious. Maybe a little less severe, but it's not a lot less severe. It's a little less severe.
Right.
So this is going to continue as long as there's lots of this floating around in the world. But what's really going to be interesting is the protection, all these infected people now, because we're having peaks we never have seen this high of peaks before. We're, you know, how much the Omicron induced immunity is going to protect the population. We don't know.
Right. Well, yeah. And now for our second COVID question. This individual had their J&J vaccine in March of 2021, and then they got a full dose of the Moderna shot in October. They heard that the J&J vaccine may no longer be protecting them. Should they get a second shot of Moderna now, or should they wait?
Yeah, no, it's always confusing with the J&J vaccine because it was really designed as a single shot vaccine. And it's been shown that that gives pretty good protection. Not as good as the Moderna or the Pfizer, and 2 doses of the Johnson & Johnson work better than 1. And what works even better is, like in this case, somebody got the Moderna vaccine after 1 shot of J&J. That's considered fully vaccinated. So right now they don't need another shot until a second booster is actually approved. So this person is in okay shape.
Okay, wonderful. That's great.
Anything right now.
Yeah, we touched on this a little bit before, but you know, does it hurt to take the take-home test if we don't know if they've been frozen in the mail or not, Dr. Murphy? I know you touched on this, but what information should we look for?
Yeah. So, like I said, I'm going to have to do a little homework here, but obviously you have a control line on the test. If that doesn't show up, the whole test is bogus. Okay, it doesn't. The whole test is not working. So we'll see. Now you have to remember, other than in 2 different instances, these at-home tests don't work very well in asymptomatic people. There's only 2, the OraSure one and Ellume are good enough to work in somebody who has no symptoms. So that's part of the problem more of the test. Doesn't really have anything to do with the temperature we're talking about, but everybody needs to keep in mind, those tests are approved within typically 5 days of developing symptoms. You have to get that tested. That's how those things were studied. So, and then whether or not the freezing is going to make it even less, you know, we don't know. We're going to try to figure that out before we meet again.
Wonderful. Now for our last COVID question. This individual in June had a runny nose for 4 days. They lost their taste and their smell, but tested negative for COVID 3 times. Will they ever get their taste and smell back? If so, how and when?
A couple interesting things about this case. Losing taste and smell is very unusual with a regular cold. It can happen, but like I said, it's unusual. Now, if these were all rapid tests, I would say I would still be suspicious that this person had COVID, and that they should have confirmed this with a PCR test. So if you're ever unsure, go get a molecular test. They're much more sensitive than most of the rapid tests, which are antigen tests. So if that happens again, please just get a molecular test, and that'll confirm it one way or the other, because they're really much better. To get approval, you only have to have 80% sensitivity. So, you know, you're missing 1/5 of the people, 20% of the people with these rapid tests. Some of them work a little bit better than 80%, but you don't confirm it with a rapid test. You confirm with a molecular test, like a PCR, And the other thing is, what about taste and smell? So let's assume for whatever reason, they've lost taste and smell after being sick with a respiratory infection. It generally does come back. However, there's a few people where it really doesn't come back. And so there are ways to treat it. So this person needs to get in the hands of a good neurologist who can try some things. They've done some behavioral modification and some imaging associated with the flavors and tastes and stuff. There are things that can be done, but this takes you into the world of a neurology specialist.
Right, definitely. Well, those were all of our COVID questions for today. Thank you, Dr. Murphy.
Okay, have a great day.